So greetings of health and wellness, everyone. I can see some of our participants are beginning to enter our Zoom room. Once again, welcome to Health Futures Foundation Incorporated's seventh part, pampito na po ito, of our free long COVID webinar series. And this time, we'll be talking about staying sane amid long COVID and dealing with post-COVID mental health issues. Ready na ho ba kayong matuto or ready to learn more about the effects of long COVID on our mental health? Marami ho ang nagre-request ng ganito pong series or webinar about mental health. And right now, we are mapalad na ito po ang ating pag-uusapan. By the way, I am Nurse Natalie David and I will be your facilitator for this webinar. This afternoon, we have a lot of people joining us today who are diagnosed with long COVID, probable long COVID patients, also family members of a long COVID patient, and health professionals. Meron din po ako nakikita bumabate from Iloilo, mga health professionals po natin, Luzon, Visayas, and Mindanao. From the bottom of our hearts, maraming salamat po for spending your Thursday afternoon with us. Once again, good afternoon, everyone. We are glad to have all of you this afternoon, but before we start, I would like to remind you to utilize the Zoom question and answer box for questions. Nakita nyo rin po, it's right below your screen. Selected questions will be addressed during our open forum, and use the chat box for your comments. And lastly, we value your feedback. So please accomplish po the application or evaluation from within 24 hours after the webinar. And don't you worry, because e-certificates will also be provided to Zoom attendees who will stay throughout the program and accomplish the short evaluation form, which will be sent towards the end of the program. Once again, maraming salamat po. Without further ado, I'd like to call on Dr. Cora de Los Angeles San Nuevo, President of Health Futures Foundation Incorporated, to give the welcoming remarks. Doc?
Yeah, welcome, webinar participants. Today we have Dr. Maria Teresa Gustilo-Villasor, a distinguished clinical psychologist who will discuss the effects of long COVID on mental health. In our previous webinars, we had topics on the most common physical symptoms of long COVID, such as brain fog, cardiovascular problems like shortness of breath, and difficulty falling asleep or staying asleep. Less recognized is the mental distress that often afflicts long COVID patients. Knowledge about long-term psychological and mental health outcomes in patients with COVID-19 is scarce. Now, is long COVID a mental health condition? The answer is no. However, it can be looked at as a chronic medical condition similar to diabetes and chronic fatigue syndrome that elicits mental health symptoms, probably because of the challenges and unknowns associated with long COVID. Now, some of my friends with long COVID experience depression, trauma-related disorders, and anxiety after their initial infection. Offhand, we see a mind versus body problem, or an interplay between the physical and mental aspects of long COVID. So, what is to be done? Our resource person will enlighten us on what is best to address this concern with perhaps comprehensive, holistic, and interdisciplinary care. For us nurses, the discussion will hopefully deepen our sense of empathy and compassion for long COVID patients. The session will also provide us with tools to maintain mental well-being for long COVID patients and their families. So I hope you will enjoy the lecture. Be ready, as mentioned, with your questions and comments. Our resource person will gladly interact with you. So magandang hapon sa inyong lahat.
Thank you so much, Doctora, for the welcoming speech. And to start the discussion about post-COVID mental health issues, let us all welcome our resource speaker, Doctora Maria Teresa Gustilo-Villasor, as she discusses the effects of long COVID on our mental health and well-being. Our special guest for this afternoon is a distinguished psychometrician and clinical psychologist. She is a certified specialist in clinical assessment and developmental psychology of the Psychological Association of the Philippines. She also obtained her Bachelor of Arts degree in psychology from the Assumption College, her Master of Arts in clinical counseling psychology, and Doctor of Philosophy degree in clinical psychology in Ateneo de Manila University. Dr. Gustilo-Villasor participated in numerous international training in various fields of clinical psychology, stress management in Stress Management Institute in Colorado, USA, psychological first aid training in Los Angeles, California, and Gujian Psychology and Analytical Psychology in School of Singapore and International School of Analytical Psychology in Zurich, among others. She is the current senior consultant in the Allied Mental Health Services section of Psychiatry in Makati Medical Center and a private practitioner in clinical, developmental assessment, psychology, and psychotherapy. Dr. Gustilo-Villasor is also a faculty in the section of psychiatry residency training program of the Department of Neurosciences in Makati Medical Center. Today, we have the pleasure of having Dr. Gustilo-Villasor as our resource speaker for this afternoon for today's long COVID webinar. She will discuss the rise of mental health issues when dealing with post-COVID symptoms, as well as to how to manage them. Once again, let us all welcome Dr. Maria Teresa Gustilo-Villasor. Doctora.
Yes. Good afternoon, everyone. I will start my screen share. Okay. So, staying sane amid long COVID. So, this is my topic. And my coverage will be, first, just a brief, the physical effects of long COVID, which you have taken up in their previous thing. But for me, I'm going to deal more about the issues of trauma. And then I have a case sample of Lisa Fisher and some anecdotal views of Filipino long COVID holders that I was able to talk to. And then after that, I'll talk about the basics, which Dr. Gora talked about already, stress, anxiety, and depression, which we call the human condition. It's called SAD. And then after that, the trauma and the grieving process, and then how we cope and accept and adjust to the new reality of chronic illness. So let's start. As you know, COVID has some sort of 9 symptoms, which 5 to 20% of patients have manifested lasting for over 4 weeks. And many of you have manifest this, and it waxes and wanes, and it's very annoying. Some of you experience it longer than others. And this can be a very baffling condition because some people cannot believe, because many of the people I've talked to, we look at it from a psychological perspective. They were very productive individuals. They have very good careers. They're what you would call type A personalities. And so they're not used to not doing anything or not allowing their bodies to do anything. Sorry. So wait, I stopped that first. So they sort of like, I'm sorry, let me go back. Not allowing themselves to do anything. Now they just have to stay in their beds. So they're very angry with themselves. So that's their first thing. They seem to manifest a new kind of condition. And when we talk among ourselves, we say, no, it's trauma. So what is trauma? Now it's a broader definition, individual trauma is something that results from an event or a series of events or a set of circumstances that is experienced by a person as a physically and emotionally harmful for them or threatening, and that it has lasting adverse effects on the person's individual, social, emotional, and spiritual well-being. So many of these people have had very productive lives. They're very causal. And then suddenly, their lives change. Many of them 365 degrees. And so they tell themselves, what's wrong with me? I can't go back to work the way I used to, no? And so they're very initially angry. They usually say, I can't seem to be functional. So there's this, I'm sorry, I couldn't video the Filipino COVID sufferers because they were under the care of another doctor. But I did ask permission to get some of their quotations. This is a video of a girl who had COVID. She very much is like some of the people I've spoken to. Her name is Lisa Fisher. And I got her quotation and she says, my life changed when I got sick. It hurts. It will never be the same. I will never be the same person again. Give me some time and I will learn to live with my limitations. This is Lisa. Just listen and look at her video.
My life before COVID, I lived a very active life.
Riding in heels.
I was a full-time international flight attendant. I traveled around the world. I was social with my friends, was a part-time yoga instructor. I was very independent. Yeah, very, very different.
Can you talk about what your life is like now?
On the world, I was social with my friends, was a part-time yoga instructor. I was very independent. Yeah, very, very different.
Can you talk about what your life is like now?
You need to take some time to grieve the life that you thought you were going to live. Throughout the last 19 months, the unknown has been the hardest part of this experience. That's the unknown physically, the unknown emotionally, the unknown of what my capacity is going to be like. How am I going to operate in this world? How am I going to be financially? A lot of people are just looking for that magic pill to solve everything, and that's not really the case, or it hasn't been for me.
So we're looking again because we are in a medicalized world. Many people are just looking for the magic pill to make it all go away and bring me back to where I was before all of this happened. I think the whole world was hit first by the lockdown, then the COVID, and now that there's no more lockdown, many of us are still being hit by the COVID or the after effects of it. These are some quotations of some of the people that I have come across who have consulted with me, and some of the people that I'm seeing on the other side, I'm seeing on a regular basis. Some of the issues that are taken in the initial session, some of these people I only saw once or twice. So let me show you. These are anecdotal. The first one is a medical resident of 32 years old. She's female, very, very active. She's internal medicine, for those of you who have taken or who are medical doctors, you know that the most demanding residency is internal medicine. And she was one of our very good medical residents. And then she got COVID, and then now she has to take a break. And she said to me, long before long COVID, I was so busy, and now I'm always tired. I don't know if I can go back to residency. And so she was very frustrated. No. The next person I met was a man of 46, a very up and very successful marketing manager. And he says he wants to go back to work because he feels so lazy and very unproductive. And he doesn't do anything, but when he gets up, after a few minutes, he's just so tired. And then there's this young student about to graduate college, and she just can't seem to get herself to go back to school, and her family thinks that she's just making arte, no? So it frustrates her because of that. And a former teacher who is now jobless, and she feels dependent, no? And so that's her problem. She feels depressed. And then there's another one who's a college professor who's age 45. And then she says there are days that when she gets up from bed, she just wants to go back to bed. And she says, I wonder if I'm depressed, but she says, I'm not depressed. I just feel so exhausted. Another female who was laid off, when the ABS-CBN thing happened also, and then she got COVID. So one frustration after the other happened. And then she said, when will this end? So is it the COVID, or is it her being laid off? So it's one on top of the other. So we're not so sure. We're still trying to figure out which is the heavier condition. And then a sportsman who is a mountain climber, you get the gist, a mountain climber, a race car driver, and then he got very ill. So he's at home, and he says, I have a hard time doing nothing because he's a very physical person, and now he cannot exert himself. So these are a few that I see, not naman weekly, but I see maybe once a month or once every 2 weeks. And these are individuals who have more or less come to terms with their condition, but still have a difficult time adjusting because they have had very, very productive lives prior to their illness. And so a colleague and I are trying to establish a study based on the type A personality and COVID conditions and trauma. So we're trying to relate that with a colleague of ours abroad who is also doing a similar study. And here it is. This is a male individual who's 42 years old. He's a businessman. He says, I'm very anxious, I'm very restless, and I'm just too tired to be angry. No, just too tired. He says, when I get angry, I get more tired, so I just don't want anymore. And a lady, a very very successful executive banker, she says, my husband and my children are very understanding, but she refuses to stop working. She says, but when I try to do things like I did before, I get so tired that it takes me a while to recover. But her husband says she brings work home. She works on weekends, and then it takes her a couple of days to recover. But she's not accepting the fact that she cannot do it the same way as before. So, and now this is an advertising executive, so he has to entertain people. He used to go out every night, but now he says he has to pace himself, and late nights are out. So according to his wife, it's a 365-degree change of personality. So he says he's a very charming, humorous man. So he says it in a very jovial way. So their personalities are still the same, but then there is that slowly there's a coming to acceptance, but really you can see that they had suffered because of trying to come into terms with the new changes in their lives, no? Now, this lady is a little older than the others, and she's 60 years old. She's the head of a family corporation. So you can see that she is going to call the shots in her family. Everybody defers to her. And she said, I have family members who help me. There are doctors I can consult. And I'm close to retirement. Close to retirement na ako. So according to all my relatives, I shouldn't be too pushy, but who's going to get the job done? So she's used to ordering people around. So, I mean, she's been able to rationalize the fact that she should slow down. No? So you can see that there are different stages of adjustment. And then I have a colleague or a friend who also says that her way of wanting to, to turn her condition around is she wants to use this to be able to help others so they can become more productive. And she is still being productive as she tries to look at how her illness is going to be helpful for others. So she wants to help others like herself. So she wants to put up a support group. So that is her way of looking at her condition. So there are many, many different ways. But you can see that there are individuals still. So the illness does not make the person. The person will transform the illness, but you will have to be understanding of it if you are going to walk with them, for those of you who are in the helping profession. So for me, I am not a medical person. The medics will take care of the breathing, of the heart condition, of the digestive system, of the rashes. But trauma is any sudden change that the body and the mind has to adapt to and has to grieve because the person has lost it. No? So the body has to grieve. And how can grief affect your body? You can see here that the body grieves because it lost something. So you have sleep problems, you have fatigue. And this happens even if you don't have COVID, no? There's there's inflammation, it will react. It will reduce its appetite. It will have headaches. It will experience chest pains. It will have nausea. It will have reduced immunity. That is grief. Interestingly, so grief has physical, mental, emotional, and behavioral symptoms. Grief only, which ironically, these symptoms are very much long COVID symptoms as well. So don't you see that the body parallels it? So maybe when you do psychological work, you can look at it that your body is grieving a change. The long COVID is grieving, okay? So this is a very nice meme. It says, the task of grief is what? There's a tear. T is to accept the reality that you lost something. You lost your life of before. Finish. You cannot be running around like a chicken without a head because you get breathless. Okay? E. It's painful. It's sad. You experience the pain of the loss. You can say that in your head, but every day when you remember that, you could do that in a snap of a finger. Now it takes you like 5 hours. That's painful. Okay. A, you adjust to the new environment without the person who can run around like a chicken without a head. You lost it. You lost that person. That person's gone. Okay? So you adjust. And that might take a week, a month, a year. Okay? R. Now you reinvest in the new reality. That's you now. So it's easy to spell it. It's easy to say it. No, but it can take months, it can take years. But TEAR are the tasks that you have to do. And so remembering that, reminding yourself, in other words, it is a form of transformation. You're going to be transformed into a very different person. That's the grieving process. Okay. And that's the psychological or psychospiritual work that you'll have to do. It's not just your body, it's your spirit that has to do it as well. So it will come into a full acceptance, and there's a cycle. That's why they used to say the cycle of acceptance is like the grieving process. They used to say, they only used to say that about Elizabeth Kubler-Ross when you accept death, because it's a form of dying. But now you die unto yourself. That old self dies so that the new one lives. But now it's 7 stages, they say. First, there was you in your normal life before you got sick. Then you had this bad news, okay? The bad news is, oh my goodness, how can this be? Anyway, I can't wait until I get better. So there's a lot of denial. And then you didn't get better, so you're upset. And maybe you're angry. The doctor didn't do this, or I'm angry with my body, how come I can't get better? And then you get depressed, and then you get confused. Maybe it's the wrong doctor, maybe it's the wrong medicine or something. Then you bargain, maybe I can try harder or something like that. And so forth and so on. You do things to yourself so that until you finally accept that maybe I shouldn't really push it. That's the new acceptance cycle. And no one can tell you when that's going to happen. Nobody. Only you will come to that point. That's what I keep saying, because people ask me, how many more? How many more sessions? How many more? And that's why I always say, we can't do this. I can't say, just say, you give yourself time. That's why even biblically, they say, to everything there's a season and a time for every purpose under heaven. And no one can tell you that. So if they tell you, I can heal you in 4 sessions, they're joking. Your healing is your own process, okay? So when they say, staying sane amid long COVID, what is our work? We who are not medical, we who are helping professions, we help ourselves. We are also survivors of trauma to heal from this cycle. We have our addictive patterns, our connections with the past. We are addicted to that. We are stuck on that. And then we lose it. So we grieve. And the way we are sticking to that is we go into our first stage. We go into denial. We deny. And then we have flashbacks of how it was with us. And so we struggle. We go into denial and we struggle, and then we grieve some more, and we are stuck there for a while. And then we go into more resistance and insistence on what we used to have. And we give ourselves a hard time, and nobody can stop us, okay? Because that's part of the process. And sometimes we feel na naloloka na tayo. And that's part of the process. And sometimes your loved ones can watch you and feel like naloloka na rin sila. And that's part of the process. It is so hard. And that's when a lot of stress happens. And the resistance and the denial and the addictive patterns and the grieving, people can stay there for a long time. But then it also is fueling self-doubt. And over again, self-doubt and shame and resistance and denial. And we punish ourselves. And that's what we call the human condition. Punish ourselves. So there you go. Until we come to a point where there is acceptance. We accept. We accept because there's no other choice. But then the acceptance is maybe grudgingly, because then we go into some form of depression where we have to get stuck in a situation where we don't know what to do, and we go into some form of self-blame and self-doubt and all sorts of things, and maybe desperation. And then we feel like we blame everybody. And with some of us, there is also turning to other things. Maybe we become more prayerful. Maybe we become more feeling that there may be alternative things. And finally, we think there is no more hope. We lost the person that we were, until we find that there's some other person aside from what we were. And we come to an understanding, and we come to a growth process. So a better understanding that you have grown in spite of. So that takes a while, and nobody can give that to you. It has to come from within. So that is when the integration process happens. So if you see, there are 7 stages, yet it is something totally new, and anxiety will surface again. Can I really do it, or am I just deluding myself? And so another journey begins. Okay. Another journey begins. And so this is what they call the human condition. The human condition will surface. But what is interesting that you will find is there are tools today more than any time that we're able to articulate ourselves. There is such a thing as psychoeducation. Now we're able to articulate certain things like this. There's research, there's counseling, okay? There's therapy, okay? And if this physiological conditions become too much, we can do psychiatric referrals, where we can refer you to psychiatrists for your anxiety, for your palpitations, for your high levels of sleep deprivations, etc. And then there's also psychospiritual counseling, psychospiritual referrals. And for me, there's really a soul involvement in this. There's an inner journey process, if you're willing to take that, because this is really a transformation. If you notice, it happens at the time when the person is at the crossroads in their lives, when they're in their 30s and their 40s. No? So when the peak of their profession and their self is sort of formed, then the journey is inward. So there is a different challenge. But that's another thing to talk about. Right now, long COVID is a physical, mental, emotional, social challenge. So I end this talk by saying, you never know how strong you are until you face something that makes your foundation shake. But no matter how much your surface has cracked, you're still standing, and you still do not break. So thank you. I'm done. Thank you very much.
Thank you so much, Dr. Gustilo-Villasor. Very relatable and a very informative discussion on the effects of long COVID in our mental health, and providing tools and techniques to maintain the mental being of both long COVID patients and their families. No, a lot of our participants can really relate, most especially all of us were affected by the COVID-19 pandemic. With this, let us proceed to the open forum. So everyone who's still with us, we highly encourage you to send in your questions via the Q&A box. And if you're in Zoom, that is. But if you are on Facebook Live, you may utilize the comment section below. So let us start. Doc, we have a question from one of our participants. Doc, can mental health issues interrupt with the physical symptoms of long COVID?
Yes, of course. It can exacerbate it, definitely. Yeah. Example, if you are to start with depressive already, no. For example, if you have had already a depressive condition to start with, and you have long COVID, that will exacerbate it. That's for sure. Yeah. So, para bang nadagdagan ka ng you're going to start thinking, why am I the only one in this world who has had this suffering, etc. So your family will have to be more careful in terms of working with you. And that one, you have to be working together with your psychiatrist. And it's not just your long COVID, but your symptoms will be exacerbated. Yeah.
That's
In your
true.
mind.
Oh,
Yeah.
well, sometimes you cannot tell if
Yeah.
I mentioned this before na sometimes you cannot tell if the effect of your palpitations are caused by the problems of the heart right after the long COVID or the COVID infection, or it's an anxiety attack, or
Correct.
it's something else. So talagang
Correct.
you're on a kumbaga na limbo kung ano
Yes.
po ang
Correct.
nararamdaman. So it's really
Oo.
better to have yourselves check. Another question, can experiences during COVID-19 infection affect the rise of mental health issues?
Oh, yes, definitely. No, that's why nga, it's so hard to distinguish the two. No, that's why I said it seems to be more, but the ones who seem to be affected by it are the ones who seem to be, as I said, the ones that I saw are type A's. Those who think that they are not affected by difficulties. I don't know about the rest of you who have seen some. Those who cover up their issues by overworking. Yung kaya ko ang mundo. You know what I mean? Yung type A personality. Madami silang trabaho, nananalo sila ng lahat ng tao, tapos nagka-long COVID sila, bigla sila nagkasakit. Yun. At least the ones that I've seen. No? So, parang napilitan silang magpahinga. Ganon. So, yung mga iba na may long COVID sila, nananalo sila, pero iba yung flavor. You know what I'm saying? But those who are workaholics and then have, like the one I gave you an example, the lady who was taking care of her family corporation, parang she's the one who's the tagasalo ng buong bayan. Yung mga ganon. Yun. So then the bank executive, yung mga ganon, parang I said, wow, these ladies, they must have had trauma even since before, but they never noticed because they had to take care of the whole world. You know what I mean? Yeah. Maybe that's a specific kind, but not all, no? Yeah. That's a specific characteristic.
Thank you, Doc. So we have one here. Hello, how to internalize acceptance in a meaningful way when society moves you to the outside in the form of job loss of healthcare, making judgment calls about the individual's personality when they are suffering medically.
Yeah. First, you have to, I know it's very, very, we have been programmed in a culture that self-esteem is very dependent on what other people think of you. No? So self-esteem is equated to self-worth. No? And that's not true. Self-worth is what you think of yourself. So I always tell that to my class. There's a big difference between self-worth and self-esteem. Self-worth is anong pagkakaalam mo sa sarili mo. Ang self-esteem is ano yung paghuhusga mo sa sarili mo depende sa paghuhusga ng ibang tao sa iyo. Okay? Kasi ang self-worth mo, alam mo naman na hindi ka tamad. Alam mo na marunong ka magtrabaho. Pero kahit hindi ka tamad, pagod ang buong katawan mo. Alam mo rin yun, correct? At alam mo kung hindi ka pagod, magtatrabaho ka, correct? Self-worth yan. Iba yan sa self-esteem. Sabi ng nanay mo, batugan ka kasi hindi ka nagtatrabaho. Sabi niya yun, siya yun, hindi ikaw yun. Gets? So you have to be able to distinguish that two.
That is very relatable also, most especially right now, when everything went back to the new normal, we are forced to perform more, no, because
Correct.
we're going outside and even proving ourselves, because when they said that it's going to be the new normal, you should upgrade yourself, mabilis ang pagbabago ng mundo, etc. And most of us really were affected by this and feeling everything, kumbaga,
Always according to how others said
yes,
you should. You have to be very clear. Ano ako? Ano ang kaya ko? Ako. Hindi sila. Kasi ang Pinoy, very blurred yung boundaries mo eh. After a while, nakakalimutan mo, ikaw, always ang feeling mo, sila. Doon ka nasisiraan ng bait. Okay?
what others tell about you. We have questions here. Doc, how can we differentiate, most especially now, ano, dun po sa mga previous na nagka-COVID or doon sa may mga long COVID, how can we differentiate sadness versus depression?
Okay, depression kasi does not abate. It's gano'n, no? Okay. Sadness is like this. There are moments na you are okay. Depression is ganun. For 2 weeks, ganun ka. Okay? It's a mood that does not lighten. So if you feel that way for 2 weeks, depressed na yan. Pero sad, kahit na sad ka, there's a moment na hindi ka sad. You know what I'm saying? Yeah.
There are heights of a little bit of okayness, happiness,
Oo.
and
Oo,
you're getting
nakakalimutan
sad.
mo rin. Oo. Ang
But
depressed,
depression,
ganun ka for days, no? Hindi natatanggal. Yeah.
okay, we have one more here. Would you recommend daw po the home care rehabilitation for adolescent depression of a 17-year-old due to post-pandemic trauma?
Depende kung ano yung other symptoms niya. Kasi, when you put a label like post-pandemic trauma, I don't know what are the behavioral manifestations. If the person is doing self-destructive behaviors and you cannot manage it, you see what I mean? Kung kayo, at saka, sorry if you are also a trigger, sorry, no. If you also are a trigger of the depression, then why the heck are you going to put the person there? You know what I'm saying? So my question is, what are the symptoms? Because if you are putting the person in the situation where the person is depressed because of the situation, then that's a different thing. Okay?
That's about right, no, Doc? Sometimes we really need to ask, magpapakwento pa tayo even more, ano, to see the situation, the whole situation, because sometimes what causes other people to be triggered is, you know,
The situation itself. And
yeah.
then you're going to be the one to take care of the person. Oh my goodness.
It won't do.
Yeah.
Ayan. Ito po, one more. What can companies do, Doc, to help workers with mental health concerns that may be brought about by the COVID pandemic? This is in general. Corporate, sa lahat po.
I guess they have to be more aware, like what your foundation is doing, no? They have to be more aware of what are the symptoms of long COVID, and they have to be more compassionate. Like for example, they get exhausted easily. So they have to give flexi time for that. And then for me nowadays, like, I don't know if they do studies of productivity of working from home and not. You know what I'm saying? Things like that. Those things have to be studied, because before, it doesn't matter whether you're productive or not, so long as you stay in the office. You know, that kind of thing. I don't know if that is still the rule of thumb. Mga ganun. Kasi before, basta wala ka dito, fired ka na. Yung mga ganun. So it doesn't only help. It's not only good for the self-esteem of the person, pati yung productivity niya nag-lower kasi hindi na siya pwedeng pumunta doon. Can you imagine if you have to commute 4 hours to the office, tapos you get exhausted easily, di wala na, hindi ka na productive. You know what I'm saying? Whereas if you can do the work at home, you can do some productive work. Mga ganung tipo. Those are the things that they have to think about now. No? Yeah.
Encouraging the companies, most especially big corporations, big companies, in the media and the entertainment, to acknowledge that there is long COVID, or the effects of COVID in the human
Yeah.
body,
Yeah.
human health even.
Yeah.
Most
And
especially.
how they can work around that and use the talents of the person. Hindi, it's not a machine. What is the talent of the person and how they can use that without having to subject them to the commuting, the mga like that. I think, no, they have to find a way. But then again, talent is so cheap. They can always hire new talent, no? So that's the hard part, the reality of it. So I don't know, really.
Thank you, Doc. We have one more here. Important question from our participant. How can we address grief, or ways to address grief?
The very first way to address grief is to tell the truth to yourself. You know, that's why, remember, your first hurdle is denial. Denial kasi is a defense mechanism. For those of you who've taken up psychology, that is the first defense mechanism of your ego. Denial is an ego defense, and it's not bad, but it's there because it makes you not want to see the truth. Why? Because when you look at the truth, masakit, Kuya Eddie. Because it shatters your illusion of what you want the world to be. So the truth that you lost something. So you deny. And also that's also the reason why you lie. You lie because you don't want to know the truth. So for instance, your boyfriend tells you, break na tayo. You don't want to accept that he doesn't love you anymore. So you tell him, matulog ka na lang muna, baka bukas you'll change your mind. You know what I mean? Why do you do that? Because you're not ready to accept the truth. Yung mga ganun. Even in small things, you listen to yourself. ano lang yan, nagkamali lang siya. Or mga things like that, even in small things. Denial is the first defense because you don't want to change the way you look at things. So even with children, if you look at children, they will ask you a question. If you say no, they will ask you a question again in another way so that you'll say yes. You see, from the beginning, you want it a certain way, and if you don't get it, you will ask it another way, so you'll get it your way. So that's the first way. When you are grieving, you cannot grieve if you do not face the truth. And the only way to do that first is to accept it, and that hurts. Remember, TEAR. So first is to accept that you lost something. Sakit, no?
Yeah, thanks, Doc. And we are not just talking about, when we're grieving, when we lost someone, but when we lost something that we have for the
Yeah,
longest time, not until COVID came. Yung mga
yeah.
ganong...
And you work so hard for it. It's not, it's
Mm-mm.
like, for instance, you work so hard to get this job, and then this stupid idiot just came in here and he got promoted and you didn't. That kind of hurts, Yeah. See, it's in anything that you have set your heart into.
Thank you, Doc. This is a personal question of mine. There is one example that you've stated, Doc, that I'm not making this up. I'm not making arte, but everyone thinks that I am this way or that way. How can we protect ourselves from feeling that people might be thinking otherwise, but then at the end of the day, I really cannot perform because I'm really tired. How would I ask the question? Paano natin, Doc, bibigyan ng barrier din yung sarili natin or protecting ourselves from that kind of mindset, most especially right now that we are really proving ourselves to the world, no? All of us na after the pandemic, we should really perform or upgrade.
Yes, that's it na nga eh. The more I saw this meme, it's so cute. Things I can control and things I cannot control. And it is so cute because you really cannot control how other people think. So stop worrying about them. You really cannot control what they think of you, to the point that your problem is you're trying so hard to control what other people think of you that you don't even control how you think of yourself. And that's the only thing you can control. Can you imagine that? You're trying, ay, baka ano nang inisip niya tungkol sa akin. Eh, hindi mo nga iniisip yung inisip mo tungkol sa sarili mo. You know what I'm saying? So it's more of that. So what? You really don't know what they think of you because guess what? Half of the time, they're not thinking of you at all. And then if they say something, they say it out loud and they even forgot what they said about you and you remembered it. When you say, alam mo, sinabi mo ito tungkol sa akin, sasabihin niya, ganon, sinabi ko ba yon? And it hurt you and you carried it for many days and it didn't even bother them. You know what I'm saying? Because you're not important to them in the final analysis. Yeah.
Thank you, Doc. We have one more here. I've been on pause for 6 months. I have had COVID and worked as a COVID nurse in a quarantine facility. I really want to go back to work but I just couldn't. Nakakapagod, nakakatamad. I have asked professional help already because I really wanted to get better. Pero parang hindi pa rin ako okay.
There is this doctor in Canada. His name is Gabor Mate. Okay. And he has a book that he wrote. He's very famous now. You can Google him. He has in YouTube, he talks about it. When your body says no, okay, listen to him and his body will tell you. his book will tell you, your body said no. So can you please listen? When your body says no, no na yan. And then he connects it with so many diseases. Your body chooses the disease. It's not by chance. And so many women develop diseases na yun pala, it is because the disease was because they were never able to say what they needed to say. So you listen to his talk. Sabi ko, ay, how cute. Look at him. Matagal na yan yung mga psychosomatic. Basta your body says no, sinabi na sa'yo, kaya makinig ka. So I used to have a professor who tells us, Doktora Karangdang, can we do this? I will listen first to my body. That's what always she says.
It's really listening to your body. You mentioned, Doc, psychosomatic, no? Talagang ganon, no? When we feel stressed, the body is really saying something, no? But we're just, na-mention din ng participant natin the word nakakatamad. Maybe we could change it to exhaustion, you know? Parang iba po yung iniisip nila sa nakakatamad, but then right now,
very judgmental.
Yeah.
Very judgmental, nakakatamad.
But they really feel this. Opo.
Oo, sinabi lang ng body mo, ayokong gumalaw, can you respect me? Oo, can you respect me? After all, I'm the only instrument who's doing things for you. Eh, ayaw kong gumalaw. Ngayon.
Yes. So it's really knowing your body language and what it says, no? About a task. This is a good question, Doc. Ano? How can individuals recognize? Paano namin malalaman, Doc, when dapat na namin gawin or when it is necessary to seek professional help from their mental health concerns on a long COVID situation?
You don't, paano mo malalaman? Malalaman mo yun. You will know. You don't have to have a checklist. You will know. Okay? Just like you, it's not as if I'm such a crazy person. I'm crazy. So anyway, when you talk to yourself, it's okay. When somebody else, when you talk to yourself, it's okay. But when somebody talks to you that you can't see, maybe there's a problem. Sabi nga nila, pag kinakausap mo ang sarili mo, okay lang. Pero kung may kumakausap sa iyo na hindi mo nakikita, may problema ka na. Okay? So,
thank you for that. But any changes, Doc? Ano? Any changes that we feel, most especially after the pandemic, if we're tired all the time, which is the very common symptom of long COVID, or something na you've been doing for the longest time, like a close friend of mine who is a triathlete, then after getting COVID, couldn't even run a mile. So these changes to your body, because ang nasa isip kasi niya, Doc, at the time, maybe I'm aging, maybe, but no, if it happens to you suddenly.
yeah, it's part of the long COVID, but that's not, if they understand that that's part of the long COVID, that's good. But the psychological effect of that is they are very disappointed at the loss. That's the psychological thing that they have to grieve. You understand? I mean, I understand if it's your friend, he understands that he lost that gift of being a triathlete. Now he must grieve it. That's the psychological loss. And can he grieve it, or he's still angry? You understand? That one is his process. There's a difference.
We have so many questions right now.
You see the difference?
Yeah.
The difference is, I understand it's a physiological problem, but am I coping with it psychologically?
Yeah.
Or am I still hoping that 3 years down the road, I can be a triathlete again. You know
Again.
what I'm saying?
Yes.
Yeah.
Thank you, Doc. We have one more here, a follow-up question. So listening to the body will better facilitate healing?
Yes, it will. Definitely. Because you are in sync with it. So whether or not I become a triathlete or not, my body and I are friends. Hindi lang na I'm just waiting for you until you can become a triathlete again. You know what I mean? I'm not gonna work with you until that time. Hindi. We will work together the way we are now. Then I'm a productive human being the way I am now. And maybe who knows if God willing, I can be a triathlete, but that I'm not looking at that anymore because I'm doing other things the way I am now. You know?
Kakampi ang ating sarili when it comes to healing, really.
Yes.
We have one more question here. Do you have any case study daw po, Doc, of clients who were able to reclaim a part of who they used to be instead of having to accept the full depth of their own past?
Oh my goodness. I think it's a little too soon. It's only COVID has only been with us. Long COVID has only been with us for 2 years. No, we don't know yet the extent to which it's gone, and I haven't had that many clients. You know, and
Doc,
besides, people change. They really do. You
yes.
know, they evolve. Yeah,
And more discoveries, no,
yeah.
will unfold. Doc, the video that you showed kanina, was she showing psychosomatic effects like nagkakaroon siya ng jittering, or was it stress,
No,
anxiety?
no, that was secondary to her. Those were neurological conditions that she had. Yeah, kawawa siya talaga. Yung hindi siya, that was very severe that she had. But when she was talking, her voice was very strong,
Yeah.
no? That stuff.
Mhm.
Yeah.
But when she tries to move, no,
Yeah.
her whole body is shaking.
Yeah.
Doc, do traumas decrease over time or can be reversed? This is a question from our participant.
Yes, it can be reversed over time, but you have to be very aware. No? Very aware of the triggers. You know what I'm saying? Yeah.
Knowing really that there is a trauma and
Yeah. And accepting, no, that oh, I was traumatized by what happened to me. Sometimes it's one patong-patong after the other eh. Kasi nowadays, before you just say, oh, na-traumatize ako kasi ganito, ganito. Before, it was just the devastation of the earthquake. You know what I'm saying? It was big. Now we have big traumas and we have small traumas. Big T's and small T's. You know, that kind of thing. But now, no. Any incident that is so nakakayanig is a trauma. Before it was just, wow, before it was, the child was sexually molested. That's trauma. Now, no, it's not only that. It's many other things. And it it's lodged in your body, no? So they have so many terms for it. Nakakahilo. Don't like anymore to think about it.
Yes, lalo na ngayon, Doc, no, yung social
Yeah,
media is also
yeah,
part of having trauma. If you're canceled, if you're a victim of bashing, etc. It's really
yeah,
one after the other.
yeah.
Ayan. Ito po, we have one more. What can we advise to those suffering with mental health symptoms from their COVID-19 infection who do not have access to psychological services?
You know, you don't, I'm sorry, you don't really have to be a psychologist. Long before there was a psychologist, we had other resources. Okay. As I was saying, if there are many people who turn to spirituality, they pray. And I think that's also a good thing. You know what I mean? And so there are many people, your family is a very good support system as well. That can be very healing also. So I think that what we turn to what we have And that can be a good, I'm not saying the psychologist is the only one who knows. No, whatever resources we have, that can be done. No. And no one resource is better than the other. So what is there for you is the one that will provide for you. I think kung ano yung nandyan, yun ang nabibigay sa'yo. No? And so, kasi kung walang psychologist noon, bakit maraming matinong tao din? Bakit may psychologist ngayon, marami ding hindi matino? You know what I'm saying? So all I'm just saying is there are resources, there are people who will come your way and they will help you.
Thank you, Doc. There is one question here. It's a good question. How can we differentiate or know if the mental health concern daw po is the effect of the long COVID versus it being the usual mental health issue?
I don't think you can differentiate because it's a human condition. Mental health because of long COVID is a mental health condition triggered by the stress of long COVID. Yeah. Okay. In other words, that is the human condition and there is the stress. The stress is long COVID. So na-anxious ka na because you were not certain of what was happening. The stressor is you perceive it. Kailan ba ito matatapos? No? And tapos walang ending. So, stressor yan. You perceive there is no ending. There's no solution. And then after that, anxious ka, you have palpitations. That's human condition. Then you keep worrying about it. Then you become sad. That's depression. You see what I mean? So SAD, that's the human condition. You are human. It is triggered. And human condition is triggered, according to Gerald Collins, who is a Jesuit psychologist. There are usually 6 triggers. First, there is death or loss. So we talk about COVID. So it can be anything. Somebody died in your family, you can have stress, anxiety, or depression. There's death, there's sickness, okay? There is betrayal. There is exile. There is a sense of loss. There is a sense of failure. So you failed in something, and then there is a sense of, is there something more in my life? So that happens. It's the human condition. So you can interpret it physically, mentally, emotionally, socially, spiritually. It can happen on all levels of your life. So we don't know. The COVID is just the major thing. Before that, it was the lockdown. And then when we got used to the lockdown, it was the opening of the lockdown. Now we're all adjusting na naman. You know what I'm saying? Just when we were all adjusting to the lockdown, binuksan na naman nila. So naninibago na naman tayo. Correct? There you go.
And on the last part din, Doktora, no, I have mentioned this to our team na it was the lockdown, then it was the easing out of the restriction, and then there was this, all of us getting all the COVID infection. And then lastly, you don't get all of this, you're not really affected with the first 3, but then you are the only last person who don't have COVID yet. So you feel so anxious that you don't
Correct.
have it yet. So all of these, no, in transition talaga would really make you feel so worried about so many things.
So you always worry. The
Yes.
worry is the constant. Correct? That's the thing. Yeah.
How do we become aware of our trauma? This is one good question from our participant.
You don't get aware of it. You just experience it. it's like you are unconscious, then suddenly natalisod ka. You feel your life is going well, and then suddenly, naano ka, in Ilonggo we call it, nasandad ka, natipalok ka. That is when you say, oh my God, mali pala ako. You know what? You thought you were doing so well. Then that's when you feel you didn't do well. So you don't plan, o baka matrauma ako. Hindi. It's like you get into an accident, not because you planned it. Yeah. It's something that you never planned.
Ito, Doc, speaking of no plans at all, how, we have a good question here. Does post-COVID trigger a disorder, a mental disorder such as bipolar? Because our participant was diagnosed after COVID.
No. You probably already had symptoms. It just got exacerbated by the stress. Okay? So because you are not bipolar because of COVID. You probably already had, you were already bipolar is, you already had mood swings, and all that stuff. But it just became more pronounced because of the stress and anxiety that you were experiencing.
Mas nadagdagan lang.
Overwhelmed ka lang, overwhelmed.
Na-overwhelm. Let's talk about, Doc, first aid. Is
Okay.
there a first aid when a patient daw po is at the height of his or her emotional and mental health symptoms?
Okay. Again, I'd like to contextualize. When you say height, what do you mean?
Oh yes, oo nga no, from our participant, paano po ba ito no? Maybe I'm thinking Doc, this is my own understanding to this. How do we handle breathlessness or maybe an anxiety attack? Is there a first aid or even a sign where we think that it's gonna arrive na? Ito na yung anxiety attack ko, pa-start na.
Kasi it is why I said in context. Kunyari, nasa mall siya at magdadrama na siya. I mean, I'm just asking.
Yes.
Magdadrama, hindi na ako makahinga, sisigaw na ako, mga ganon. Or what? I mean, kasi you have to contextualize. You have to tell me an incident because it can't be the same for everyone, di ba?
We'll be asking for the anonymous attendee to clarify the question.
To give me a case, yeah.
This one, Doc, is 1 week naman daw pong low. If 1 week pong low feelings, is it considered depression? And what could be the best action of the person affected and the significant other? Saan po ba sila magpapakonsulta?
Kung low ang feeling niya. When they say low, hindi natutulog. See, you know me, I
Yes, yeah.
Kasi pag sinabi mong low, baka malay mo, baka ayaw lang niya ikaw kausapin. No?
Other symptoms na, which are normal when people are sad.
Yeah, when they don't like to talk to you, ikaw naman, kausap mo, ayaw kang kausapin. O di wag mo akong kausapin. Sorry.
We'll have it clarified from our participant.
No mood. Ayaw makipag-usap, ayaw matulog, nagdadabog. You know what I mean? I'm asking for symptoms.
Yes.
Hindi naliligo. You know what I mean?
Yes.
What are the symptoms? Because,
what are the lows?
Yeah, what do we mean by that? Because when you just say low, irritable, suplado, or what? What? You know?
Thank you, Doc. Intervention, Doc, on what we should do when we feel or we can't really at all sleep, or is sleeplessness part of a long COVID symptom or effect?
Not necessarily. Sleeplessness can be a symptom, an indication of mental health problems. Can be. Okay? Not just of long COVID. See? So if you do not sleep for more than 3 days, or if your sleep is very mababaw and restless, something you have to consult already. Haven't you heard the song, Hindi ako makatulog, hindi makakain? Okay. There was a song when I was a little girl. I remember it. I didn't realize I was going to become a mental health person. Parang, I will not sing it, baka umulan. It says, I hear singing, but there's no one there. I smell blossoms, but the trees are bare. All day long, I seem to walk on air. I wonder why, I wonder why. I keep tossing in my sleep at night. All at once, I lost my appetite. There's something about all at once, I lost my appetite. Bells used to, anyway, all at once, then there's a refrain. You don't need analyzing. It is not so surprising that you feel very strange, but nice. Put your head on my shoulder. You need someone who's older, because I've been there once or twice. You're not sick, you're just in love. Oh. Symptoms of being in love.
Symptoms pala of being in love. So sleeplessness could be or could not be a symptom or an effect of long COVID. We
Oo.
have one question here, Doc. How about the management of the impact to medical practitioners?
The management of long COVID.
Of stress or mental health issues, lalo na po yung kanina same thing na question niya na he is a nurse or he or she is a nurse and it really affected him mentally.
Yeah. That's why it has to be, when you have this, especially yung health workers, what you've been through has really been a lot. So it's sleeplessness, empathy, compassion, fatigue. It's been a lot. Hindi talaga walang katumbas yun, what you've been through. So therefore, stress, anxiety, and depression is really high. And so it has to be taken in context when you go. That's why we had the Bayanihan group in terms of that in Makati Medical, where they would come in and walk in for counseling, and then for medication with our psychiatry group and our psychology group. They would walk in and just talk. Then we do medication as well and sleep. We always listen first to their condition. It's very important that you have first to listen to what they've been through before you provide medication. And then we always require sleep as a first line of defense.
So you also recommend supplements like melatonin, etc.
Yes. Melatonin is important, but then sometimes it doesn't help. Sleep, medication with anti-anxiety is important. But with the prescription of the psychiatrist, anti-anxiety with antidepressant already is needed for, I think, 2 weeks.
It's good to find out muna, Doc, before we go through medication and other ways to manage sleep as well. It was clarified to us na, Doc, about the first aid when a patient is at the height of his or her emotional and mental health symptoms. What he or she mentioned was attacks like shaking or panic mode.
high panic attacks na siya.
Mm.
Oo, ano na yan, kailangan psychiatric. Oo, kasi anxiety, high levels ng anxiety na yan. So, panic attacks na muna yan. So, psychiatry na muna yan, psychiatric. Huwag na ninyo antayin. So you have to go to the psychiatrist. They have to give some medications for that. Oo.
We have some here raising their hands. Okay. This is congratulations, because thank you so much. Although most of our attendees put it on anonymous, it's really okay, no? So you can put it on anonymous mode if you want to ask a question. Maybe, Doc, we mentioned to our participants how getting yourselves checked, no? May it be confirmation of or going back to your doctor after a COVID virus, kung nagka-COVID po kayo, or how important it is to have yourselves checked. Na-mention nyo, Doc, yung mga ways, no, or mga tools to find out and to get through, no, what you're feeling emotionally, and breaking the stigma that it is just the same as having diabetes or any physical disease that we have, that mental health should also be addressed.
Yes, oo, of course. Mabuti na lang ngayon, ina-address na nila.
Because way back talaga, Doc.
Yeah, it's already a law. One of these days, it's already a bill, a mental health bill. Hopefully, magiging ano na yan. It will be included na in your insurance. O, di ba?
And I hope it could be a part of an OPD checkup.
Oo, sana nga, no?
Sana ganon, with the PhilHealth. I hope it should be covered, because one participant is saying, why is it so expensive nga daw po, no?
Oo, nakakainis. That's why sometimes, especially during COVID, what they'll do is they'll go straight to the primary care. Tapos they will consult with mental health. Bibigyan sila ng tranquilizer. Oh my God, ang lakas ng binibigay nilang tranquilizer. By the time they get to us in psychology and psychiatry, bangag na yung pasyente. Hindi na
Broken.
Kasi hindi kami covered. So, when they come to us, their medication they will have to buy. So it is one of those problems. You know what I'm saying? So we're saying, huwag niyo muna ninyong gamutin. Huwag niyo muna bigyan ng gamot kasi nababangag sila. Oh my God.
Na-alter.
Oh.
Doc, do you suggest or recommend a healthcare practitioner be psychologically evaluated before coming back to work?
For if they had long COVID, you mean?
Yes.
Yeah, I think so. Yeah. Most of in our hospital, they do. They go through, especially our ER doctors, because they've been through so much stress. They're really under so much stress, no? So they go through. We do a lot of debriefing.
Much better din po, Doc. It's like a self-check as well. Kumusta na ang status mo after din po of the infection or the long COVID even. We have question here. How can I show compassion to myself going through this? I used to be the one that helped others.
Kaya nga that's why. How come you're mad at yourself that you got sick? Naubos na yung compassion mo sa iba. You know what I'm saying? The more you should be compassionate with yourself. As they say, bawal magkasakit kasi nag-aalaga ka ng may sakit. So it cannot be. You have to be compassionate with yourself. More so. How can you be? by deciding you will be compassionate with yourself.
Thank you so much, Doc. A probable long COVID patient is on our group right now. I sometimes feel sad that I've recovered and lived when I badly wanted to go. What are some activities I can do to help myself? Although I'm also looking into getting professional help.
Um, well, if I am to speak frankly, since we don't know each other, that part of you that was before doesn't live anymore. So you got your wish. It's not that part of you doesn't live anymore. This is a new you. So you have to start. You have to live again. It's a new you. So you have to start fresh. See, you said didn't want to live. So it's not living anymore. This is a new you. Okay. So that's your challenge.
That the past you is gone and this is the new you that you want to start over. You can start
Yeah.
over.
Yeah.
Effective and preventive measures, Doc, to for those who are experiencing mental health issues.
Uh, you know, I always say, when you say what are the preventive measures, I I'm always so baffled when they ask that. Para may checklist ka. No. And it's not as easy as that. The only thing you have to remember is there is you are maybe three things. First is that you are well now, and that you do one thing at a time. You keep healthy, you eat the right food, you do what's good for you, and you do what's good for others. Basically, that's it. And don't overdo stuff, which is a tendency, you know. Kasi when you tend to overdo stuff, that's already the beginning of everything. Do
Just
good.
like
Yeah. Pag mag-oo ka sa lahat ng tao, I'm going to tell you, you're going to get sick. Correct?
mhm.
When you cannot say no to everyone, then you begin to say no to yourself, then you get sick. Correct? Yeah.
Thank you, Doc. Last question we have here. But let me just read all the comments. Very worth it webinar. It almost makes me cry realizing that Doctora was right, that we cannot grieve until we accept the truth that something painful happened.
Yes.
Indeed, indeed to our attendee. I was a while ago actually, no? Parang it was hitting us on the right buttons and maybe and realizing that parang okay, what I'm experiencing is normal and the things that I should do, most especially acceptance and not lying to oneself, is really one way to really accept that we have changed and we've lost something that was part of us before. Ito po, Doc, how do we integrate what you have learned from psychoeducation to your everyday life? For me po kasi most of the time, it is easier to know your own cognitive processes. However, how can you heal more of yourself in relation to the different aspects of your life? Since healing in behaviors is important as much as mental.
You know what you have accomplished before you got long COVID. Okay. You might not be able to do all of that, but that doesn't mean that that's not part of you. That's you. But that means you don't have to do it anymore. Okay? The only reason why you feel you have to do it is because you're an addict. You're addicted to that. And what your body is telling you is that you're finished with it already. It's just challenging you to do something different. You see what I mean? What am I trying to do? I'm trying to tell you, you have to change your perspective. You have to look at yourself in a different way. You have to start looking at yourself in a different way. Kasi that's the problem with us. We're kind of tamad. Once we look at ourselves in one way, ayaw na nating umalis doon. Okay? We're stuck there. And that's part of the denial. Okay? All of us are like that. We're all stuck in the denial, naka-epoxy tayo doon. So, your body is telling you, hindi ka na dito. That's only part of your resume. Tapos ka na dyan. Stop insisting. Move. Try to use what I gave you, your imagination. Use your imagination about what else you can be. Ngayon, ang problema lang, pag ang imagination mo, gusto mo maging pole dancer or gusto mo maging triathlete, hindi ka na pwede doon. Okay? So, use your imagination for other things. Okay? Yun. Ganon.
That's a good also a final message to our participants. And one participant is saying, thank you, Doctora, for actually acknowledging our experiences as long COVID patients. Part of the support we need is in the form of healthcare professionals who do not marginalize or gaslight us. Your willingness to walk with people who are suffering comes through on this webinar. And I am glad that there are people like you who present clear ways to reframe and navigate this traumatic experience. COVID indeed is a traumatic experience to all of us, but some will really, most especially to those who get affected, no, Doctora, with so many types of variant ng COVID, no, it's really indeed a traumatic experience to them.
Yeah, that's true. Mm-mm.
Thank you so
And
much.
another perspective.
Another perspective. Yes, channeling to a different self, and
Yeah.
Accepting really is yun po yung talagang number one number one that we need to we've heard kay Doktora ngayon pong hapon. And yes, thank you for 200 plus almost, no? I asked a lot of questions, and thank you so much also, Doktora Gustilo-Villasor, for the very rich, enlightening, and of course, relatable to all of us discussion. And before you go, I would like to award you with a certificate of appreciation on behalf of HFI. Health Futures Foundation Incorporated awards the certificate of appreciation to Dr. Maria Teresa Gustilo-Villasor for the very enlightening talk on in staying sane amid long COVID, dealing with post-COVID mental health issues webinar on June 22, 2023 via Zoom. And it is given 22nd day of June 2023. Signed by HFI President Dr. Cora de Los Angeles Anuevo and HFI Chairman Dr. Jaime Galvestan. Thank you so much, Doctora. Before we end this webinar, of course, if you have your final message to our participants.
Thank you very much for listening. It was so nice to talk to all of you. Thank you.
Thank you, Doc. Before we end this webinar, HFI invites everyone to attend our upcoming long COVID webinar series. We have one more, no, this coming July 2023, and we will have our 8th long COVID webinar entitled Tired of Being Tired, Dealing with Post-COVID Fatigue. And our key resource speaker is Dr. Mona Lisa Dunca, a rehabilitation medicine specialist who will discuss how post-COVID fatigue affects our bodies. And we will also have Dr. Madeline Valera, who will share her personal experiences on dealing with the post-COVID fatigue. Kindly tune to your emails and HFI's Facebook page for more details of the webinar. We are hoping to see you there. As we approach at the end of today's webinar, HFI would like to thank Dr. Gustilo-Villasor for discussing and sharing her expertise on the effects of long COVID in our overall mental being. Of course, our utmost gratitude and appreciation goes to all our webinar attendees who join us, participate, and even ask questions as we learn new knowledge that is timely and relevant to our objective to achieve holistic health and wellness. And of course, help us improve our future webinars by answering our short evaluation. You may visit at bit.ly/HFI LCMH EVAL. So you can also scan the QR code on the screen, and the link is also sent on our chat box. And please be reminded that the deadline for answering the evaluation form is only until the 23rd of June. That's tomorrow at 4 p.m. lamang po. Again, I would like to remind everyone that we will only be sending e-certificates to Zoom participants who stayed all throughout the webinar and accomplished the evaluation form. So there, help us reach more people by following us on our socials. As you can see on your screen and in the chat box comment section, you may visit us at our website at www.healthfuturesfoundation.com. On our Facebook, it's facebook.com/healthfutures for timely health tips and for the latest news and updates on HFI's events and projects. Meron din po kami facebook.com/alaga.ka for news and updates on HFI's banner project, Alay sa Ginhawa at Kalusugan, o tinatawag po naming Alaga Ka. Follow us also on Instagram and Twitter, that's at Health Futures. Subscribe to our YouTube channel at Health Futures. And we are also on LinkedIn page, that's linkedin.com company, Health Futures. And thank you for staying until the end of the program. And we hope you learned a lot from our speakers. Again, this has been Nurse Natalie, your facilitator for today's webinar, Staying Sane Amid Long COVID, Dealing with Post-COVID Mental Health Issues. Have a good day and see you in the next events.